You likely believe you would be able to recognize the symptoms of a significant disease, right? The reality is that you may not. More than 86 million Americans, or 1 out of every 3 adults, are pre-diabetic. Yet, 90% of them are oblivious of their condition. This is a concern because if you don't realize you have it, you're not likely to make the necessary changes to prevent the condition from becoming full-blown diabetes. Welcome to One Stop Health's 4-part series on diabetes. In this series, we are going to inform you of the 4 parts of the diabetes spectrum, how you can spot the symptoms, get the help you need, and ultimately reverse this deadly killer. As we've said before, 90% of people with prediabetes are oblivious that they have the condition. Prediabetes is not a harmless condition since it precedes the beginning of type 2 diabetes, a chronic illness that may result in circulatory, neurological, immune system issues, and in some cases, death. The majority of children and people with prediabetes show no symptoms, particularly in early stages of the condition. If prediabetic symptoms are present, they often involve at least one of the following. You're gaining weight rapidly. Carrying around extra fat, particularly around the midsection, increases the likelihood of developing insulin resistance, a key risk factor for developing diabetes. Being overweight puts stress on your pancreas to create sufficient insulin and makes it more difficult for the insulin you produce to perform its intended function. When the majority of your weight increases occur in your abdomen, it indicates that you have fat surrounding your organs, which may also bring you closer to the diabetic risk zone. Your skin is behaving in an unusual way. There are often no symptoms connected with prediabetes, but in some people, it may manifest itself through milder forms of symptoms that are typically linked with diabetes. For example, feeling thirsty or having the urge to urinate more often are 2 examples of these symptoms. Changes to the skin, such as discoloration or skin tags, are also warning signs. Some people who have prediabetes may show indicators of insulin resistance, including darker skin in the armpit or on the back and sides of the neck, as well as a large number of tiny skin growths in these same places. Be on the lookout for any skin signs and discuss your concerns with your primary care physician if they persist. You've had blood sugar problems in the past. Women who have been diagnosed with gestational diabetes during pregnancy may not quite return to normal after giving birth to their children if they have been diagnosed with this condition. Even if your postpartum examination reveals that your blood sugar level is normal, you still have a significantly higher chance of developing prediabetes and diabetes in the future. The same is true for mothers who gave birth to a child who weighed more than 9 pounds at delivery. Your ancestry and ethnicity are significant. You have a greater risk of developing prediabetes if diabetes runs in your family, particularly if you are African American, Alaskan Native, American Indian, Asian American, Hispanic or Latino, or Pacific Islander American. Restless sleep. It doesn't take much time for your body to go out of whack when you don't get enough sleep. A lack of quality sleep may lead to weight gain, which in turn can increase your chance of developing prediabetes. Blood sugar levels may be severely disrupted by a variety of sleep disorders, including obstructive sleep apnea. If you are having trouble sleeping, you should discuss the issues with your primary care physician. Seeing a doctor about it might help you stay out of the pre-diabetic danger zone. An extreme lack of hydration. A condition known as polydipsia, or excessive thirst, is brought on by high levels of blood sugar in the body. In a normal person, the kidneys will filter and reabsorb any glucose that is present in the bloodstream. However, when glucose levels are high, the proteins in your kidneys that normally bind to and reabsorb glucose become saturated. This prevents glucose from being reabsorbed. As a direct consequence of this, glucose does not get reabsorbed, but rather is expelled into the urine. When glucose leaves the body through the urine, it takes water with it. This causes the thirst response in your brain, which prompts you to drink more water to compensate for the water lost. Frequent urination. Polyuria, which is another name for urinating often, almost always coincides with an abnormally high level of dehydration. When you have high blood sugar, your body rids itself of a significant quantity of water, which comes out in the form of urine. This water loss through your urine may lead to dehydration of the tissues in your body, which can manifest as symptoms such as nausea, dizziness, headaches, constipation, and even fainting. Contact your healthcare practitioner if you notice that you have the desire to urinate often, and there's no other obvious explanation for this urge. It's possible that this is an early warning sign of diabetes. Blurred vision. According to the findings of the majority of studies into prediabetes, at least 5% of people who have prediabetes also have diabetic retinopathy. Diabetic retinopathy is a consequence of high blood sugar levels that is caused by damage to the blood vessels in the retina. Vision that is cloudy or wavy is one of the most noticeable early symptoms of diabetic retinopathy. Other symptoms include the following: seeing black or floating dots, having difficulty reading or driving, and color vision that is impaired. You are always hungry. When you have prediabetes, your body is unable to absorb blood sugar as well as it previously did. As a result, you do not get the same amount of energy from each snack or meal as you formerly did. Because of this, you have a greater propensity to experience feelings of extraordinary hunger and the urge to consume more food. However, if the cells are unable to absorb this energy in an effective manner, the sensation of hunger will persist even after a large meal has been consumed. This is because a shortage of nutritional energy drives the brain to send signals to eat more in order to ingest more foods that contain energy. Frequent infections. Having high amounts of glucose in your body may cause harm to your immune system, leaving you more vulnerable to becoming ill from infections and viruses. It's possible that you have diabetes if you often have colds and flu in the absence of any other risk factors. How do you test for prediabetes? A simple blood test is the most effective method for determining whether or not a person has prediabetes. The A1C test, which evaluates the amount of glucose that is bound to the oxygen-carrying protein hemoglobin in your blood, is the one that's considered to be the most accurate. It is a useful indication of the average level of sugar in your blood over the last 2 or 3 months. What exactly is prediabetes? Your blood glucose levels are higher than usual, but they have not yet reached the threshold of diabetes. In order to help you have a better grasp on what constitutes normal, prediabetes, and diabetes, these are the ranges for each individual's blood sugar while they are fasting. Below 100 is considered typical. Prediabetes levels between 100 and 125. Diabetes with a blood sugar level of more than 125. How can you determine whether or not you are in danger? You have a larger likelihood of getting type 2 diabetes if you have a large waistline, which is defined as having a circumference of 35 inches or more in women and 40 inches or more in men. Insulin resistance is a disease in which your cells react slowly to insulin, a hormone produced by your pancreas that escorts glucose into the cells so that they may utilize it to manufacture energy. A large waist size is often a sign of insulin resistance. If you are overweight or obese and have one or more other risk factors for developing type 2 diabetes, your healthcare provider will most likely order a test. These are the other risk factors you need to be aware of: having a parent or sibling who suffers from diabetes, not engaging in any physical activity, unhealthy levels of blood pressure, high levels of triglycerides, having a low HDL cholesterol level, a family history of coronary disease or stroke. Native Americans, African Americans, Latino Americans, Asian Americans, and Pacific Islanders are examples of high-risk racial and ethnic groupings. Being obese, having polycystic ovarian syndrome, or having acanthosis nigricans are all factors that are related with insulin resistance. It is possible that you have one, some, or none of these symptoms at all if you are diagnosed with prediabetes. Because of this, it is essential to get your fasting blood glucose level checked about once every 6 months to ensure that it falls within a safe range. Alterations to one's lifestyle, most notably the reduction of excess body fat, are often successful in reversing prediabetic levels. Changes to one's way of life are the primary forms of therapy for prediabetes. To get started, you should take baby steps, such as increasing the amount of physical activity you do, moving to a diet consisting of whole foods, and cutting out processed carbs and sugar from your diet. You'll be happy you did. In part 4 of this series, we will go more in depth of the lifestyle changes you can make to stop prediabetes and diabetes in its tracks. Hit the notification button to not miss part 2 of the series. In this episode, we'll be taking a look at type 1 diabetes. Thanks for watching.